Welcome to On the Spot, May 2012. This month we're going to talk about your dreams about the new hospital. The new hospital project is on schedule, it's on budget, and we are now less than 30 months away from the grand opening. It's hard to believe. It was only 18 short months ago that the early phases of the project were starting, and we were soliciting from you and inquiring from you your ideas about dreams for the new hospital and what we wanted it to be. And we heard themes like healthy, healing, teamwork, and very, very exciting things. And now we want to revisit staff and get some updated dreams to see where we are now that we're getting real close to midway in the development cycle. So let's hear from staff.
My dream for the hospital is that through collaboration and creativity, we are able to standardize our work processes and to improve our systems in order to deliver the highest quality of care for our patients.
I think we're all blessed with the opportunity to work in a brand new building. My dreams of the new Sutter Medical Center of Santa Rosa would include a building design that really began with the end in mind, one that's designed for healing and privacy of our patients, including all private rooms.
And I think what I look forward to mostly is the private rooms for each patient, because I think with all that is now coming into healthcare with teaching and the use of the computer in the rooms, I think it's going to make a much more intimate sort of care setting. I also look forward to a time when we can have a smoke-free campus, completely smoke-free, and also having gardens, and we do have some gardens here, but because it's not a smoke-free campus totally, sometimes you're in the healing garden and you end up getting whiffs of smoke or whatever.
What I'm looking forward to is the patients having their own rooms and more room for family members, lower infection rates, new equipment, like a smoke-free campus. That would be a given. And equipment by the bedside. I think having the single rooms will help a lot, though.
Maybe some of the items that are around the hospital and take to the new hospital that I think is very important for us to continue to be able to reminisce and talk about, hey, I remember that.
And so maybe the new hospital, well, I know it will, it'll have better cohesiveness in transporting patients, patients finding where they need to go for inpatient, outpatient procedures.
I'm also interested in the ambiance that we have in the new building and the color scheme. Florence Nightingale really noted way back when, in the beginning, that color, the intensity of color and the texture around us influences healing. And so I'm really interested in having a calm, serene feel walking into the building and using our color and our textures in a very subtle way to support that process. As a former smoker, I know how difficult the transition for a smoking campus to a non-smoking campus is going to be. But I think it's imperative that if we are going to role model good health in our community, then we have to be, the people who carry that light. And as difficult as it is, I think that the move is going to be one that will benefit the patients and the staff.
Dreams inspire all of us, and this new hospital is a great stimulator of dreams and so very exciting. The design of the new hospital incorporates so many wonderful things, the ambiance of healing gardens, of patient family spaces, of private patient rooms. It's really, really awesome. But we want to up the game a bit more from there and really move to a new level. And to do that, we're forming a very special planning team. It's called the Ambience Committee. That's going to be headed up by Everett Hendricks. And this is a group of employees we want to engage with us to really put the fine touches on how we make our new hospital something very special from the very first day we open. So if you'd be interested in serving on this team and participating on this team, please contact Ruth. You'll see Ruth's contact information on the screen, and volunteer, because we'd love to have your ideas. This will be another opportunity for the five-star team to really shine and really take our great work, our great teamwork, our great care, our great services, and move it up to a new level. So please get involved and please contribute your efforts. Another part of our new hospital is going to be making processes efficient for the patient. And we got a question this month from the laboratory about when are we going to see the quality delivery system or Kaizen improvement events in the laboratory and other departments. Well, it's going to happen. It's going to be gradual and incremental, but it will happen. For the laboratory specifically, as we go into the next phase of our emergency department value stream, we're going to be looking at the diagnostic support services of radiology and laboratory. And in those, we'll be engaging lab staff and helping to refine and improve processes. That's not going to be the total story in the long run, but that's the first step of the journey. Thanks for asking the question, and we'll see you soon in the lab as we get involved in the ED project. Thanks much.